All right, we got a recording here. Let me see. Allow
Okay,
recording.
I'm going to try the same thing, but it sends a request.
Okay, done. Good. Thanks for meeting me here, Dr. Seager.
Oh, it's a pleasure.
So you've been writing a book. Is this published now?
It is. Yeah, you can buy the limited edition. Like we haven't sent it to Amazon. It's only available on the Morozko Forge website right now. We printed up 300 copies. We're going to send it out to people and get feedback. And hopefully, we'll get some reviews. We'll get some ideas about how to make it better. And then we'll go to Amazon this summer. Do you want one?
Yeah, sure.
Good, because you're already on the list. Like they haven't all arrived from the printer, but you're a pro customer, and we're going to send books out to all the pro customers anyway. And besides that, I need your feedback. I need you to tell me how I could make it more useful to you and how I could make it a better book.
Sure. Yeah, I know something about that. I actually published 2 science fiction novels on Amazon some time ago.
How'd it go?
I don't know. I don't pay attention to it. They're just there. It's just a project of mine. I spent like 10 years writing them, and I was like, I'm gonna publish this stuff.
This one has been so much work. It is 3 times longer than my dissertation.
Wow.
And it probably took me just as long.
I can tell you, it took me a long time to get that book published.
Yeah, I'm proud of it though,
For sure.
because the world needs it so bad. You can just see on Instagram how many misconceptions and like people who are full of crap. They'll post as if they know what they're talking about. They'll even like underneath some of my posts, they'll say, "Oh, this is nonsense. Oh, that's not true." And I'm like, "All right, I'm going to take my 600 scientific citations
Yeah.
over your Instagram competence, buddy."
And then I'll rebuttal them with, do you actually run a primary care practice with a cold forge in your office? And I have no answer to that because no one's doing this. And
Well,
I'm going to present to you what I have collected
hell
from
yeah.
patients. And I've tried to get them to fill this out. It's been a bit difficult to get compliance of filling this out, but I think I have a couple, at least about 10 or so. And call this the Iron DPC's Cold Forge Retrospective Practice Audit, right? Because that's what this kind of is.
That's brilliant.
Again, Iron Direct Primary Care is anti-aging medical practice, bringing high-level athlete modalities to the general population, primary care. So attached to the medical offices, we have a backyard area. We have a gym, an outdoor gym. You can work out in the sunlight on the beach. We're right on the beach here. And we also have a traditional sauna. And then inside this old 100-year-old carriage house, we have the Morozko cold forge. We have EWAT, which is exercise with oxygen therapy, red light therapy, and we have the vibration plate with the X3 resistance bands. So the methods for this questionnaire and the specifications. So my dad, Thomas Hartmann, aerospace engineer, he maintains the Morozko at a strict 36 to 38 degrees Fahrenheit. Now this is Florida, and we had to actually install an AC unit, a mini split in that carriage house to actually maintain the ambient air temperatures. We only were able to achieve these 36 to 38 degrees Fahrenheit when we put the AC at about 68 degrees Fahrenheit. So that's a critical thing to note, because when it was too hot in there, we never hit these freezing temperatures. And the freezing temperatures we've identified are critical for the changes we note in patients, right? They will go to other places, maybe they have a cold plunge or whatever, and this like warmer, they do not find the same benefits and the same changes as we find. And again, they have access to this area whenever they want. They had some membership only, they come whenever they want. So they can come at 4 a.m. if they're wild, or they can come at 10 p.m. I tried to create this questionnaire. I asked some people. I asked Dr. Bradley Goodman. He's a pain management specialist, and he told me to look at the COMBI, which is the clinical outcome measurement brief instrument. Basically, I took a lot of different questionnaires from a variety of sources to see which one might reflect well with the patient, because they come here for an all variety of reasons. So I'll start with myself. Me, 31 years old. I really created this whole place for myself. I didn't care if anyone signed up for a membership here. I wanted it for the performance benefits because I played tennis tournaments. I'm 31 years old, and after playing 2-3 matches a day against these 17-year-olds out there in a professional circuit, my body's pretty beaten up. And I have to do this over consecutive days, typically Saturday, Sunday, and sometimes Monday. And so between matches and after a day of match, I will come to the cold plunge, and it's helped me tremendously get back the next day to train and play and compete. And my body doesn't hurt as much. So we have other athletes who will come here. We have a couple of professional baseball players, and we've had college football players, and they all tell me mine is way colder than anything they have back at their home base. This is a patient, 62 years old. He's been doing it for about 1.5 months, and his cold plunge is at 5:30 a.m. The disease he's trying to treat is inflammation, soft tissue pain, and fatigue. So I asked him to rate his pain or symptoms prior to the cold plunge. He rated it a 6. After the cold plunge, it is a 0. And I put this, the facial, this is a common one we use in medicine to ask patients what their pain scale is, the 0 to 10 one. And then after the cold plunge, I asked a subjective from the combi, which is, do you feel very much improved, worse? He described very much improved on figure 2. What number best describes how prior to cold forge that pain symptom has interfered with your enjoyment of life? He rated this a 6, and this is from, again, the combi, which it's a scale of how much does your pain interfere with your life. And after the cold plunge, he describes, let's see, what did he describe? So afterwards, let's see, energy levels afterwards. So describe fatigue energy levels prior to cold plunge. This is 6. Describe energy levels after cold forge, 0. Okay, that's good. We didn't get an assessment of his pain level after, or enjoyment of life afterwards. And we can imagine it's much better. Let's see, rate mood before cold forge. We put it at a 5. And again, that's this is a mental health mood scale, right? He put it at kind of 5, neither happy nor sad. And after the cold forge, he puts at a 10, happy, high, awesome, and great. That's pretty cool. And I also wanted to ask how long these benefits would last. He says the benefits last about 4 to 6 hours. He goes 3 times weekly minimum, and the length of time submerged is 4 minutes. I also asked, are your hands and feet submerged? He says no. He doesn't put them in, probably because a lot of people find that their extremities cannot tolerate it. They get too cold, so they don't do that. I also asked if they dunk their head, because I know some members do that. He does not. And the other treatments he's tried, NSAIDs, which is like ibuprofen, Advil, chiropractic, deep tissue massage, physical therapy. And how does the cold forge compare to the meds supplements? He says better overall results. Now I asked Dr. Goodman, like, what would show significance in any sort of retrospective practice audit? He said the only thing we'd have to show is if this is equivalent to anything else, right? Injections, surgeries, ibuprofen, pain meds, chiropractic. So even if we can show this is like equivalent, that's significant. But we're showing that in his case, better overall results. And we also asked other results identified, because we don't know what the stuff might additionally do. And he says he's lost 5 pounds over the past 5 weeks with no other variables changed. Why might you think that happened? I have a couple ideas. What do you think?
I think it's reduced inflammation.
Yeah, I think so too.
I also think that if he continues his practice, he's unlikely to lose more weight. It won't, like, there's, what I've observed is there's initially a loss of 4 or 5 pounds. It doesn't take very long. And then there's a plateau, and it's because they're shedding water.
Yep, that's exactly it.
It sounds like we agree. Yeah.
This is Thomas. This is my dad, 60. Let's see what he's been using this for. I don't think he deals with pain. What he's used it for is sleep. He's found it's helped him with his sleep. He actually dunks his head in here too. He stays in about 2 minutes. His mood does improve with it. He's a happy guy in general, but it does improve somewhat, right? He says he's tried a lot of things for his sleep, like melatonin, adaptogenic herbs. He says cold plunge is the only treatment that has repeatedly improved his sleep. This is another interesting result. He says the roughness on his skin is gone. His joints feel more lubricated even during exercise. My mind is clear. I feel energetic. I can work out with the X3 band super intense after the cold plunge until complete muscle fatigue and grow muscle steadily. I am more tolerant to the cold. Now, why would his skin roughness improve?
So this one is really interesting because he's the first one who has been explicit about this. I've heard other people say that they have experienced improvement in their skin, but they've never communicated to me like a skin roughness or a measure. So it's an area in which I don't have a lot of expertise or knowledge. However, what if he was getting a metabolic boost that helped his skin, that is those lower layers of his epidermis, kind of revved up their new skin cell production? And I'm out on a limb speculating here. I'd really be interested in your hypothesis.
Beats me. I don't know why his skin is smoother.
Well, it might be a coincidence.
Yeah.
However, does he have a history of allergies?
No, no.
Okay.
Not an allergic.
I've heard from a number of customers who said their allergies resolved after several months of regular ice bath practice. We're looking into that. There's a relationship between the immune system and modulation of autoimmune disorders and cold exposure. So there could be something there. But if your dad doesn't have a history of allergies, I don't think that's the right avenue to pursue either. I have a friend, he's down in Florida, Amate Eschel. He owns the Young Goose skincare company. You can buy an ointment. And I'm going to run it past him. He's a customer, is a regular cold plunger, and he knows a lot about skin. So I'll ask.
Okay. Let's see. This is a younger one, 29 years old. Let's see. She's been doing it 6 months, time of day, usually evening. She uses it for anxiety, depression, and back pain. She has a herniated disc. She's only 29. She says back pain's at a 6, depression's a 6 or a 3, anxiety is about an 8. No, anxiety is an 8, depression's a 6, back pain's a 6. Okay. So please rate your pain after cold plunge. So anxiety 5, depression 5, back pain 3. So it does decrease the back pain somewhat. She says after the cold plunge, she feels much improved from anxiety and her back. Let's see, energy. She said describe fatigue level prior to cold plunge as a 7. After cold plunge, she has much less fatigue. It's very good. So it goes down to a 3. And again, this is the energetic scale here, figure 4. So it would be more like a mild fatigue more than a moderate fatigue. All right. And let's see what else. She notes energy benefits for 1 to 2 hours. She'll practice this 3 to 4 times a week. She stays in about 2.5 to 3.5 minutes. She does not submerge. Her feet does not dunk. Head, full body is submerged. What other treatments has she tried? She's tried for anxiety, depression, yoga, meditation, medication, therapy. Seems to be very helpful for anxiety compared to medication, which I experienced many negative side effects from and very little positive effects. Back pain, she's tried physical therapy, similar relief in much less time. That's significant there, right?
We see this result a lot. The improvement in mood and reduction in anxiety associated with brief acute cold plunge therapy is consistent among those people who are suffering and have tried talk therapy, they've tried medication, and all of those have failed to result in long-lasting improvements. They get improvement from cold plunge.
Yes. 40-year-old here. He does it 2 days in 1 week time of cold, 11 a.m. Okay. Yes, I remember her. She had costochondritis from a virus. Yes. She had a cold, she was coughing, she got that costochondritis, which is inflammation between the ribs in the cartilage. And she came into my office and I offered the cold plunge, but she was like, I don't want to do it. I gave her the conventional treatment, which was dexamethasone, a steroid shot. And it seemed to help her for some time, but it did go away. And she got a bit of psychosis from the corticosteroid. So the pain came back. She came back and she got into the cold plunge. It fixed her very well. So we noticed that for costochondritis, she got a benefit of 36 hours, which is more than the dexamethasone achieved. And she had to come, I think it was 2 or 3 times. So over the course of the next 1.5 weeks, and she was able to maintain the relief of the costochondritis without any medications. And, if you've ever had costochondritis, I've never had it, but I've seen a lot of patients with it, and it's debilitating. They can't take a deep breath in. And it's actually pretty bad because if they don't take a deep breath in, they can get atelectasis, collapse of the alveoli, which can lead to pneumonia and can be a very bad outcome if they develop pneumonia from something so simple as a bit of inflammation in your cartilage. So terribly painful condition, seen a lot of injuries can cause like trauma, stretching the wrong way. And this cold plunge is an amazing modality for a very challenging disease.
Let me summarize. She did her first cold plunge and she experienced relief for 36 hours.
36 hours relief, one cold plunge.
Remarkable. But then, and that probably encouraged her to come back and continue it. Was there ever a complete and lasting resolution of her symptoms?
Oh, yes. With the costochondritis, typically, if you look it up, it lasts about 4 weeks, sometimes 6 weeks, depending on why it happened. So, once the costochondritis, it's going to start going away anyway. But what you do in medicine is you just give them the pain medicine until it heals anyway. Maybe it sped the healing because she recovered in about 2 weeks, which is the quicker time to treatment success than the typical course of costochondritis, which can last up to a month or 6 weeks. So maybe it speed the healing, or maybe she just resolved it in 2 weeks' time because she is young. 40, she should get through a costochondritis, but it was debilitating for her.
Did she experience or report any adverse, I hate the term side effects, but any unwanted effects from the cold?
No, she's described steroid and glutathione cocktail shot gave her relief 1/2 as long as the cold forge relief. The cocktail shot took a couple hours to start working. The cold forge made the pain go away almost completely within seconds the first time, and the second time it took several minutes, and the pain didn't go away completely, but much better still. The second time, I had been in a lot more pain due to a lot of coughing from another virus that hit me the day before. Ibuprofen and Tylenol didn't help at all on the days I didn't use the cold forge. I took ibuprofen every day otherwise. She had raised energy levels and focus and much easier to breathe after the cold plunge and move.
What we have here is an effective relief of her symptoms that at the minimum allows her body to complete the natural course of healing with less discomfort and probably fewer risks.
Yes.
And because compared to the medication, because there are fewer adverse effects or unwanted effects, it sounds safer.
I think so. And she didn't need a shot. She didn't need to take pills. It was great. Okay, let's see. Yes. So
I love this. I love the screenshot with the writing and the handwriting. It's really good.
I gave them the opportunity to fill it out in the Google Slides or to print it out themselves. So let's see. He does it early AM. He has chronic pain. The pain, let's see. No pain after the cold plunge. Typically, he's at a 3 or 4. That's pretty good. Very much improved. Let's see. Describe fatigue energy levels. Not bad, 1 to 2. No fatigue after. Okay, that's very good. Rate mood before cold plunge. It's about an 8, not bad. After cold plunge, 10. Gets energy benefit for 4 hours. He'll go 1 to 2 minutes a week. 1 to 2 times a week. He'll stay in 3 minutes. Cold plunge is the only thing that has numbed my pain. All right. He's tried everything other with chiro, supplements, meds, PT.
This is an interesting description because he uses the word numb. And, it's just a patient picking words. Most people wouldn't say it's a numbing effect. Most people would say it's a relief. Now, he might be experiencing numbing because sometimes people associated cold with numbness. I'm guessing that if we were to interview him in more depth, he might use words that are similar to what other patients who have rheumatoid arthritis and they experience complete relief after a cold plunge. They are free of pain, not not just the sensation of pain, but the underlying cause of the pain, the inflammation and the stiffness is also gone. It's a little bit different than when you get numbed at the dentist's office.
Yeah, a little bit different.
Because they haven't lost sensation altogether. Many of them report feeling more alive, more vibrant, even more sensitive to their environment.
I know this guy. He's a regular at this facility. He's 74 years old. He's been doing this for about 5 months. He comes at 12 p.m. He's here for joint pain, fatigue, muscle pain. He actually has titanium hips bilaterally. He got them a couple years ago, and it helped him some, but he still suffers with chronic pain from these prosthesis. So his pain is about a 6 on average. And after the cold plunge, it comes down to a 1. That's very good. He's told me sometimes he comes here twice a day because he seems to get a couple hours relief, and then he has to come back again sometimes because the pain is so bad. But overall, he's described it much improved. Let's see. Also, energy improvement. So before, maybe his energy is like a 5. He's moderate fatigue, and then no fatigue after the cold plunge. The mood also improves from a 4, which is in the middle, not happy nor sad, to a 9, which is overall happy, high, awesome. The energy benefits last 2 hours. He comes here. I tell you, this guy's out here every day. I always see him here. Length of time submerged in the cold forge to obtain results 4 to 5 minutes. The hands, let's see. Yes. Dunk. Yes, he dunks head. He's tried everything, I think. Chiro, massage, PT, myofascial work helps somewhat. Natural supplements do not help. I know he does turmeric, curcumin, that sort of stuff. Ibuprofen helps best, but he doesn't like to take it too much because he's very naturally minded. The pre-workout plunge energizes him for the resistance training we have here. The sauna that we have neutralizes or cancels the cold forge benefits. Definite pain reliever, but when doing sauna after, pain returns. Okay, so pain, interesting. Have you heard that one before?
No, that is fascinating. It sounds like he might be doing a little thermal contrast going from the forge into the sauna, because it's not clear if he's doing the exercise in between the two.
Yes, he typically does a cold plunge and then they do exercise after. That's what I tell everyone to do here.
That's fantastic. And then he'll go in the sauna?
I don't think he does the sauna too much because it seems to cancel out his pain benefit. It might be because if you have the metal in your body, the sauna might heat up that metal too much. It's not an infrared, but it's still a thermal sauna.
I've never thought of that. That's remarkable.
Yeah.
I wonder if he's curious about his testosterone levels.
Very good, actually. One of the best ones I've seen, old or young.
Do you have the number at the ready?
Yeah, no, I think it was like 600 total. It was pretty good for, anyone, even a 70.
For 74 years old, 600 total T. There's a lot of guys who'd be really happy with that.
Yeah.
Mm-hmm.
Even younger guys. But that's
I suppose, yeah.
I just gave a lecture on male hormone optimization. I'm going to publish it on my YouTube channel next week. But that's actually a generational thing, it seems like. I've seen younger generations actually have lower testosterone than older generations. And it may be, a variety of factors attributed to this.
I agree. It's physiological for certain, but there are also psychological elements. And that part, I don't know how to help people with. We can talk about magnesium, we can talk about zinc, we can talk about metabolism, we can talk about cold and exercise. And yet I do think that I've heard from so many men in their 20s that seem stuck on their testosterone levels. I think there's so much talk about toxic masculinity. There seems to be an assault on masculinity and testosterone in our pop culture. And it might be having this sort of psychological T suppression effect on the younger generation.
I like that.
And that's wild speculation.
That's a good theory. Let's see. This is a report I got through my EHR. Good day, Stefan. I want to give you progress report. Started a cold plunge 4 times a week, 4 or 5 minutes. I decided to maintain my diet, 2,400 calories, add no cardio, and continue my current training protocol. No variables changed except the addition of cold plunges 4 times a week. Now at the end of 6 weeks and approximately 23 cold plunge sessions, I'm down 14 pounds from 265 to 251 pounds. On top of the weight loss, my aches, pains have greatly diminished with 0 NSAID use in 6 weeks. Very impressed.
That's a happy patient. I wonder if we can get an update on that patient. You know, how are they doing now? It's been 3 months or something like that since this report, 4 months, I guess. And I would be surprised if the weight loss continues at anything close to that rate, 2,400 calories. And he's probably thinking, or this patient's probably thinking that the cold is helping burn calories, but I'm skeptical. He might be sleeping great because compensatory metabolic mechanisms will reduce your core body temperature at night. This is great for your sleep, but it also reduces your overall calorie burn while you're sleeping. It might be that, you know, he's come down a little bit, but this pace of weight loss, I doubt he would maintain without making other adjustments. And I'm just guessing.
I mean, with his diminishment in pain and aches, this is probably loss of inflammation in the body.
Yep, I agree. And now that he feels better, he can start walking. He can like add, it doesn't have to be a lot of cardio. He doesn't have to sprint or something like that, but he can get his heart rate up in some other ways, and he'll probably change his body composition some more. Whereas before, pain would have kept him from doing the kind of exercise his body really needs.
Yeah.
It's remarkable, Stefan. You're doing fantastic.
I know, it's super cool stuff. Okay, this guy, 43-year-old, he was treating his sciatica, and he noticed much improvement. His pain was at a 7 before, and then afterwards he feels very much improved. Let's see. Describe fatigue level 7. Okay, kind of fatigue. Afterwards, energy level came to a 2, so that would be from moderate to severe fatigue to none to very mild fatigue. Very good. Mood, let's see, before cold forge, a 5. That's kind of like a flat, not happy, not sad. And then after cold forge, a 10, happy, high, awesome, great. And then the benefits of energy last 4 hours. He comes 5 to 7 times per week. He stays in 3 to 4 minutes. Let's see. Hasn't tried any other meds, supplements, Cairo, and he's pretty happy with the cold plunging. This is the same guy. I examined him here in my office. I think he had a couple different things going on, probably facet syndrome, maybe a little bit of, was it piriformis syndrome he had? Yeah, it could be too. We have to get imaging to know exactly what it is, but it could be facet, it could be piriformis. It's, you know, you can get sciatica from both of those.
He's the first one who's reported an increased range of motion. That's not a typical thing for somebody to, no, maybe they're just not testing themselves, but I don't hear that except from him.
Yeah, it might be exactly that. He's not testing himself. Maybe if there's arthritis in the facet joints, he's not going to move very much. If it cools off the arthritis, he has more range of motion.
It makes total sense. Because his pain is reduced, he'll expand his range of motion without pain.
Well, yeah, that's why when I worked in pain management for a time, the reason they give steroid injections into the facet joints and then they do the rhizotomy, the burning of the nerve, is so that they have more range of motion, so that they can do physical therapy, so that they can rehab and get better. But I think cold plunge can provide a similar benefit, and they're going to get more range of motion. They can do the exercises to get better.
That is brilliant.
Yeah. Let's see. 37-year-old going in the morning, treating inflammation. Okay. Pain before is a 6. Okay. After cold plunge, it's a 2. That's good. Feels very much improved after cold plunge. Prior to cold plunge, how bad did it interfere with life? 6. So pretty significant. Energy levels prior to cold plunge were a 7, afterwards a 9, so a slight improvement there. Mood didn't change very much. She notices all-day benefit of the cold plunge. Goes 6 days a week, 2 to 3 minutes. Other results identified: inflammation reduction, recovery, and reduces the brain fog. Excellent. Very good. Let's see. 45-year-old, she does it at noon daily. She reports pain relief, improved mood from cold plunging. Oh, yes, I think I remember this patient. She was she had a bit of a traumatic brain injury, got in a car accident, and she had some baseline like brain fog, couldn't really get through the day, losing paperwork. And yeah, she noticed some improvement in her cognition. Obviously, we were doing other things as well, doing some hyperbaric chamber activity, doing some supplements as well. But the cold plunge, she has noticed the best relief in her pain from the car accident with coming here to the cold plunge, and improvement in the mood.
Joe DeTore is a scientist at University of South Florida. I'm not sure how far he is from you. He might be on the wrong side of the peninsula compared to you, but he also experienced a car crash and a traumatic brain injury. And he said, I wanted to throw everything at my own brain: hyperbaric, magnesium, red light, cold plunge. And he brought his brain back online to the level that allows him to operate as a PhD level research scientist again. His approach is, we're just going to try everything. We don't need, controlled individual variable or single variable studies, because we're trying to make people better. And
exactly.
He's on the right track. When it comes to TBI, there are so many things that we can do. The brain is so complex, and they are essentially free of risks. We know what hyperbaric is going to do. We know what magnesium is going to do. And at the very worst, it's not going to hurt. So we might as well put it all together.
Yeah, I agree. And I have sometimes had that conversation with patients, because if they've come from conventional practices where they just prescribe one drug for one treatment, and then they come here and we have this multimodality approach, this may be a little bit different. And you have to explain that to them. And they're like, well, I feel better, but I don't know what it was that was making me better. Well, sometimes it's synergistic.
Agreed. And what Joe helped me realize is that we can do these multiple modes. We can get improvement in a patient. And remember, I'm an engineer. I don't practice any sort of medicine. I don't care. I'm not a clinician. I don't care for patients. I do a lot of reading and I talk to a lot of people. After they get better, we can subtract. We can say, all right, let's try it without the hyperbaric. All right, let's try it without the cold. And if they're maintaining the quality of life, the satisfaction with their cognition, then it's fine. They don't have to put as much effort into it. If they notice some degradation in their cognitive capacity, then let's keep with what's working. This is for the people who are really curious about, was it this, was it this, was it this? You can start with all of them and subtract them later, see what happens.
Yep, precisely. Yeah, and that's all I have for now, is about 15 cases.
Well, this is magnificent. This is the kind of thing that I think would be super helpful when you come up to Phoenix. We're going to have our conference. We'll have a bunch of research scientists, some clinicians. I want to share this video with Marco Santello, Human Performance Lab at ASU. He's sort of procrastinating about getting his own study going. And I want to give him a little shot in the butt to say, hey, just start getting people in there, Marco. This is what Stefan's looking at. He's mostly looking pain and mood. And I think Marco wants to get some physical performance, some exercise measures. Yeah. But that's fine. You're sort of putting him to shame now, because he could be starting, he could be learning, but instead he's fidgeting. So if I send him the video, maybe he'll get off his ass.
Yeah, the way he explains to me, he's like, oh, we first need the mechanistic data to make sure it's safe. I'm like, I bet he's going to put 23-year-olds in there, college students. I mean, they're pretty healthy. Maybe they had a binge or before. That's the worst they have.
Yep.
Like, what I'm dealing with is people with chronic pain, with depression, with anxiety, like severe illnesses here. And like, this is helping them. And like, let's just put people in there and see what happens. I mean, there's no side effects. We have noticed no side effects from this.
Yep, I agree. But this also makes you and Marco a really good team.
Yeah.
Marco is, deliberate and incremental, and he'll like, well, now I must get into the research, and perhaps we'll write an NIH preliminary grant, and all these things that you're not going to do. You're going to say, I'm going to try this. I'm going to see if it helps people. I got a 74-year-old who says there's nothing better than this, and he's off all his meds.
Yeah.
Now, Marco can sort of systematically dissect that. And if the two of you are working together, I think it's a magnificent team. So I can't wait for you to meet him in real life. I can't wait for you to come up. I think we're off to a great start with a conference that, I haven't even finished planning yet. So just come on up.
Okay. When is this conference?
June 27th through 29. And a conference is a bit of a misnomer. It's going to be you, me, 8 other guys.
Okay.
Yeah.
All right.
I'm going to bring in a couple of vets who, with traumatic brain injury, who've been using cold plunge to eliminate the brain fog, to improve their memory, to improve their mood. And now they're working in the nonprofit sector, counseling other vets, because I think the latest stat is we lose 1 a day to suicide. And this intervention is immediate and powerful. And right, we got to get this into the BAs. We got to get this into the hands of clinicians, but in particular, psychologists who, are prescribing drugs like it's Halloween or something.
Oh, yeah. Like, I worked in psychiatry before. I know how that is.
That's what I mean, psychiatry, right?
Pill mill. The other place that needs is the pain management institutes, right? They're given the steroid injections, put them in the cold plunge. They have the numbers to really see the benefit, right? If you want a real study, go to a pain management. They're seeing 60 a day. Put them through the cold plunge. You'll see very rapidly that it's equivalent to the steroids.
Agreed. So here's something else. I want to upgrade your unit. I'm concerned that you have to keep it at 68 degrees. It's not the way it's designed. I'm wondering if maybe the evap coils don't have good thermal contact with the tub. There could be any number of like workmanship issues that degrade the performance, but that's not really why I want to upgrade it. We've got like 30% more cooling going on. We have a new configuration. We have a spiral evap coil. And so you'll see kind of like a mountain of ice in the bottom instead of the flat sheet. The cooling is much more efficient. It doesn't use any more electricity to make just as much ice because thermodynamically it works better. And it will take me, it might be a couple of months, maybe 6 weeks, but I want to get our Florida guy, Adam Jezik, I don't know if you've met him, and I want to get him to swap your unit out and get you a brand new one. And then you can tell me, hey, it works better or it doesn't. If it allows you to keep your room instead of 68, more like upper 70s, something that would be a little more energy efficient on your air conditioner and maybe a little bit more comfortable for your patients, then I'd be proud to have you do it.
All right, we'll try it out. Yeah.
Okay.
Sounds good.
Right, give me a month. Well, at least. Yeah.
And the next evolution we need the high facility throughput Morozko, right? We need a heavy duty one. Industrial.
I agree.
Yeah.
After that is putting a bigger pump. We have a pump that is twice as big and a filter is 3 times as big, so it'll take more flow. And
that's key because
one I really want you to have.
We have to dump the water every week because it gets too cloudy. It doesn't filter long enough.
Yeah, I don't want that. Yeah. Okay. We haven't built that. It's on the bench and it's working great, but we have not installed it or sold it. And I need field data on, are you experiencing an improvement? Is there less maintenance? Do you have to change your filter more, less, this kind of thing? And you're such a curious experimental guy. I think you're a pretty good field site as well.
We are, man. We have a really cool setup here, and it's attached to the medical building. So we have the members; they can come whenever they want. But then we also have the patients. And if I have a patient who needs it, like the lady with the costochondritis, I'll give them that option. I'll be like, listen, we have ibuprofen, we have steroids. This is the conventional. However, we have this other thing out back that you could try, and it's experimental, but it can work. But we're all about experimental things to have low risk. Let's do it.
That's wonderful. And I like the distinction that you're making between patients and members. I need to be more careful because I'm not claiming that the Morozko is a medical device. And you're drawing this distinction. There are these things over here. These are medical procedures. Here's a non-medical thing that you can do and see if it works for you. It's very safe. And then people say, I'm getting these medical benefits. And you're going, wow, isn't that wonderful?
Yeah, it's wonderful. How cool is that?
Yeah, it's brilliant, Stefan.
All right, very good talking to you. Keep up the good work.
Yeah, let's stay in touch.
All right.